Hello, this is another online residency program for another module. And that module is, let's see, outcomes and indicators, surgical site infection. Okay, let's start the test. The patient is undergoing exploratory abdominal laparotomy for suspected perforated bowel. In preparation for surgery, the nurse will remove only the pubic hair with electric clippers. No. Patient's abdominal and pubic hair with a manual razor. No. The patient's abdominal hair with electric clippers outside of the OR. No. The patient's abdominal, chest, and pubic hair with electric razor. Yes, electric. The nurse awaits notification that the OR suite is available. The circulating nurse calls to say that the incision time is set for 2:15 p.m. The current time is 12:45 p.m. The most ideal time to begin the infusion of the prophylactic antibiotic cephalosporin would be so what is the peak of cefazolin? Is it 30 minutes? So it should be 1:45 p.m. Not sure. The exploratory laparotomy findings led the patient to undergo a sigmoid colectomy. Oh no, due to confirmed bowel perforation. The colectomy procedure took 4 hours to complete. Which of the following would increase the risk of SSI infection? Length of the surgery, dirty wound due to exposure to feces, blood glucose level of 48 milligram per deciliter during surgery. All of these answers are correct. Oh, all of it. Oh no. 4 of 6. Question 4 of 6. The patient is scheduled for an elective thyroidectomy. Which of the following pre-existing conditions or past history would be most likely to increase their risk of surgical site infection? Increase the risk for surgical site infection. Elective thyroidectomy. Jaw surgery. Removal of the thyroid will be here. Smoking, 1.5 packs per day. Question 5 of 6. A patient's nurse is reviewing the pre-op checklist. Which of the following interventions would not be appropriate for this patient? Informing the patient's family when the surgery is expected to begin, which is not appropriate for this patient. This is appropriate. Administering prophylactic antibiotic therapy an hour before the incision time, of course. That's appropriate. Ensuring the patient's armband information is accurate. Checking IV access points for patency and a patient's nurse is reviewing the pre-op checklist. Informing the patient's family. Why is it not appropriate? Administering prophylactic antibiotic therapy an hour prior. An hour? Should it be an hour prior? Should be 15 minutes before? I don't know. During a patient's surgery, the scrap nurse notices an unsterile package of 4x4 gauze lying on the sterile instrument tray. Oh no, unsterile. The nurse should notify the surgical team and request a new sterile instrument tray. Open gauze. Open the gauze package and place the sterile gauze on the tray. Oh no. Remove the package from the tray and continue with the surgery. Do nothing? No. This is hard. My goodness, that's so hard. Okay, online activity. Outcomes and indicators, surgical site infection. Surgical site infection.
This program is designed to provide an overview of surgical site infection, SSI, discussing signs and symptoms, prevention, and interventions related to SSI. The program will support clinical professionals in applying the best available evidence in practice as it relates to surgical site infection. After completing the course, the student should be able to recognize risk factors for surgical site infections, identify signs and symptoms of a surgical site infection, recognize evidence-based strategies for preventing and managing surgical site infections. Click on each item for more information. Value-based purchasing describes care purchased by an insurance company from an organization based on the quality outcome measures for that organization. For example, an insurance company is more likely to pay for care from an organization with better patient outcomes than from an organization with poorer patient outcomes. Reimbursement may also be guided by the use of the outcome measures. Measures that evaluate the results of overall care, for example, mortality, readmission rates, hospital-acquired infection, but that do not evaluate whether or not specific interventions were performed. The CDC defines a surgical site infection, or SSI, as an infection that occurs after surgery in the part of the body where the surgery took place. Surgical site infections can sometimes be superficial infections involving the skin only. Other surgical site infections are more serious and can involve tissues under the skin, organs, or implanted material. Note that click on each item for more information. 1 in 24 patients develops an SSI after surgery. An SSI accounts for 3% of surgical mortalities. Up to 31% of all healthcare-acquired infections, HAIs, are due to SSI. Note that an SSI is diagnosed if the wound infection develops within 30 days after surgery. For surgeries involving implants, such as hip replacement, the window for SSI is extended to 90 days after surgery. Causes of SSI include introduction of bacteria from the air, surrounding skin, direct contact from another person, or internal wound contamination. Patient risk factors for surgical site infection include level of wound contamination, obesity as defined by BMI parameters, a history of ischemic vascular disease, malnutrition, which may lower serum albumin and other nutrient levels necessary for healing, diabetes mellitus, older age, a pre-existing wound or remote infection, a history of smoking. Surgical risk factors related to the surgical procedure include the length of the procedure and inadequate preparation of either the patient or the staff themselves. Operations that last over 3 hours increase risk of surgical site infection. Emergency procedures increase risk of SSI since there is no time for bowel prep or patient showering prior to surgery. Proper skin prep and cleansing solutions should be chosen based on the type of surgery being performed, and evidence-based cleansing protocols should be followed closely. There are 4 surgical wound classifications that increase in severity from Class 1 to Class 4. The higher the class number, the greater the risk of surgical site infection. Class 1 surgical wounds are also known as clean wounds. Clean wounds do not show signs of infection or inflammation. These wounds typically do not involve the respiratory, genitourinary, or gastrointestinal systems. Examples of Class 1 surgical wounds include elective cardiac surgeries and eye surgeries. Class 2 wounds are also called clean contaminated wounds. These are clean wounds that have an increased risk of infection. They may involve the gastrointestinal, respiratory, or genitourinary systems in the case of uncomplicated surgery. Examples of Class 2 surgical wounds include ear surgeries and gynecologic surgeries. Class 3 wounds are also called contaminated wounds. Contaminated wounds usually occur with introduction of a foreign object or contact with gastrointestinal leakage into the wound. Examples of Class 3 wounds are wounds caused by a bullet or knife. Class 4 wounds are also referred to as dirty or infected wounds. Class 4 wounds include lodged foreign objects, including debris or bullet fragments. These wounds are normally traumatic. These wounds may also have come into contact with pus or fecal matter. Symptoms of a surgical site infection include pain at the incision site, which may include a hard or firm feeling to the incision site. Purulent drainage from the incision site, which may or may not be malodorous. Redness around the incision, as well as swelling and warmth in some wounds. Some wounds may not be warm even if they are infected due to inadequate blood flow to the site. Systemic fever with or without accompanying malaise. Drag the statements below into the boxes to indicate whether they are true or false.
SSI, or surgical site infection, is one of the most common HAIs, hospital-acquired infections. Maybe. Okay. Diet and age may increase risk for surgical site infection. Diet and age. Yes. 2-hour surgeries increase risk for SSI. No, should be greater than 3 hours. Patient obesity does not increase. False, it increases. SSI is diagnosed if an infection develops in the wound within 30 days after surgery, 90 days with implants or prosthesis. Yeah, surgery on the lungs is considered a clean wound. No, it's Class 4 wound. All right.
Preoperative actions are essential to overall prevention of surgical site infections. These actions may include, but are not limited to, the following. Administer a prophylactic antibiotic at least 1 hour prior to incision, 2 hours for fluoroquinolones or vancomycin, Studies show that administration between 0 to 30 minutes prior to a procedure is more effective than when the dose is administered 30 to 60 minutes prior to a procedure. Clean surgeries that do not involve prosthetics or implants do not require antibiotic prophylaxis. Remote infections, urinary tract infections for example, should be treated prior to any surgical procedure if possible. Cancel elective procedures if remote infections are not resolved prior to operative date. Dose antimicrobials according to patient weight. For example, vancomycin at 15 milligrams per kilogram or gentamicin at 5 milligrams per kilogram. Redose antimicrobial prophylaxis during long procedures and if the patient has had significant blood loss. The interval should be 2 times the half-life from the time of last dose, in most cases the preoperative dose. Preoperative prevention of SSI includes multiple factors, most of which address reduction of surface contamination by hair removal and appropriate skin cleansing of both patients and staff. Bowel preparation should only be used for patients undergoing bowel or abdominal surgeries. When clothing patients in non-sterile theater wear, consider dignity and privacy issues. Using alcohol-containing skin preparatory agents has been shown to reduce SSIs more than single-ingredient skin preparatory agents alone. Intraoperative prevention includes careful surgical scrubbing with nail cleansing, sterile attire for staff participating in the operation, proper patient skin preparation, and maintenance of a strict sterile field. The patient should be monitored closely to ensure proper body temperature and circulation are maintained, and blood glucose and oxygen levels remain within normal levels for the patient. Recent studies show that certain surgeries involving the abdominal cavity may have the risk of SSI greatly reduced by using impervious wound protectors to guard the sides of the cavity, while retractors are used to gain better visibility. Post-operative prevention of SSI involves aseptic, non-touch dressing changes. Use sterile saline for any wound cleansing if needed within the first 48 hours after surgery. Avoid using antimicrobial ointments or debridement substances on any wound unless specifically recommended by a wound specialist. Remember that patient homeostasis is just as important after surgery as during surgery. Patient education on infection prevention cannot be overlooked, especially since more patients are being sent home earlier in their recovery or the same day as their surgery. Patients with suspected SSI should be started on broad-spectrum antibiotics that cover likely causative organisms until organism is confirmed by microbiological tests. Patients may use tap water for wound cleansing 48 hours post-surgery if the wound has separated or has been lanced for pus drainage. Consider consulting specialist wound care services. Do not use Usol and gauze, dextranomer treatment, or enzymatic treatment for SSI debridement. Click on each item for more information. Give prophylactic antibiotics if indicated within the hour immediately prior to surgery, preferably within 30 minutes or less prior to surgery. Vancomycin or fluoroquinolones may be given up to 2 hours prior to incision time. Dosing antibiotics by patient weight is recommended. Prophylaxis may not be indicated prior to clean, non-prosthetic surgeries. Cancel elective surgery if the patient demonstrates any signs or symptoms of remote infection or infections, including sinus infection or UTI. Surgeries lasting more than 3 hours increase the risk of SSI. Most prophylactic antibiotics should be given 1 hour or less prior to incision time. Use clippers, not razors, for hair removal, and only if necessary for the procedure. Remove hair outside of the OR. Temperature regulation and glucose control are important to reduce incidence of SSI.
Okay, let's answer the post-test. The patient's undergoing exploratory abdominal laparotomy for suspected perforated bowel. The patient's abdominal inches pubic hair with electric razor. There's awaits notification that OR is available. The circulating nurse calls to say that the incision time should be 30 minutes, okay? The incision time is set for 2:15 p.m. The current time is 12:45. So if the incision time is at 2:15, 1:45, begin incision prophylactic activities of fastening. The ideal is 30 minutes before the incision time. So that's 1:45 p.m. Or yeah, the exploratory laparotomy findings led the patient to undergo a sigmoid colectomy due to confirmed bowel perforation. The colectomy procedure took 4 hours to complete. Visual following would increase the risk of SSI, length of injury, dirty wound due to exposure to feces, bad glucose level of 248 during surgery. All of these answers are correct. All are correct. A patient is scheduled for an elective thyroidectomy, which if found pre-existing condition or past history would be most likely to increase their risk of a surgical site infection, previous surgery, smoking. Patient's nurse is reviewing the pre-op checklist, which if found interventions would not be appropriate for this patient, informing the patient's family when the surgery is expected to begin, administering prophylactic antibiotic therapy an hour prior to incision time. It should be 30 minutes prior to incision time. During patient's arm, of course, you need this. During patient surgery, the scrub nurse notices an sterile package of 4x4 gauze lying on the sterile instrument tray. Notify the surgical team and request a new sterile instrument tray. All right, I don't know. Oh, I passed. The answer is patient's abdominal hair with electric clippers outside of the OR. Electric clippers, not razor. Okay. So the answer is, oh, except for vancomycin, which should be 2 hours, up to 2 hours. 30 minutes or less is better. All of these answers are correct. Smoking, significant risk factor for development cause of surgical site infection. An hour prior, it should be 30 minutes. Oh, an elective thyroidectomy is considered a clean, non-prosthetic surgery, and patients undergoing these types of procedures should generally not receive prophylactic antibiotic therapy. Notify the surgical team and request a new sterile instrument tray. Okay. Okay, I'm done. Finish. Thank you. That's the end of this module.